Hi everyone, this is Dr. Stryker with Lincoln Crossings Dental Care. I'm here with one of my good patients who she's having a bit of an issue aesthetically with one of her teeth, and she's going to describe kind of what's going on, and we're going to kind of walk you through what we're going to do to fix it this morning, and then do a short video on the before, and then in a couple weeks maybe here the after. So I'll let her introduce herself and kind of describe what's going on.
Hi, I'm Olivia, and so when I smile, I've always noticed that right next to my front tooth, that tooth always looks smaller compared to the others. The gum just comes down way further compared to the other side, so we're hoping to fix it up today and it will look better when I smile now.
Yeah, and so this is a pretty common cosmetic problem that we see. Patients who are really trying to get like a really nice, perfect smile is sometimes the gum levels are just uneven, and it's a relatively easy fix. There's just a couple steps we'll go through today. So we'll get her numb, and then we have a laser that just kind of reduces some of the gum in that area. And then sometimes I have to do a little contour with the bone, and then she'll heal up really nicely, and it'll look much more even and look really nice. So I'll kind of walk you through the procedure here. This is our patient's tooth. As you can see, if you look at the difference between this tooth here and this one here, this one just looks a little bit shorter, has a little bit more gum tissue and potentially a little bit more bone covering the crown here. So if we measure this tooth over here is about 7 millimeters, and the one on the left is about 9 millimeters. So what we'll do is we'll kind of measure this tissue and see where we're at and see how much we can take off just tissue-wise. And if it's just tissue, it can be really easy, just a little bit of a laser, and we'll kind of outline the ideal shape of the tooth here, and then we'll make it match. We'll probably get pretty close. So this is the after results, immediately after. You can see the tissue's a little bit red, but the one on the left is the one we worked on today, so now it looks more like the same size like on the where I'm pointing here, and it looks nice and symmetrical on both sides. So this took about 10 minutes or so, and it really just balances out the smile. And from here the patient's she'll have a little soreness today, and the only special instructions are going to be just not to brush that gum tissue too hard, but she can brush and pretty much. So Olivia was a great patient for us today, great demo patient, and she did really well. So as you can see, this is a pretty easy and quick thing that can really, balance out a smile and just kind of really enhance the symmetry and has everything about the aesthetics. So I think she's really happy with the result, and we'll check back here in about a week and 2 weeks and see how everything looks. But I imagine she'll heal up really nicely and it'll look beautiful. So